Hey guys, Dr. Adam Sewell here, and I wanted to make a special video because it's a very pertinent topic regarding our health and our safety in America. As you know, the Biden administration has basically been importing illegal immigrants into this country. They did it through basically unsecuring the borders, promoting illegal immigrants to come to this country. And because of that, what we found now is that there is a huge increase in tuberculosis. A lot of physicians are talking about it. The CDC finally admitted that there's actually an increase in cases, and now it's starting to come out on the news saying that many of the diseases that we normally screen for when we have people that come through the country through the normal legal process, of course, are not being done at all. And so now we have basically large amounts of tuberculosis spreading throughout the country. Here I have a couple articles pulled up for you as references. This is an article here called from the Heritage Foundation showing that Biden is encouraging massive illegal immigration and is hiding it with secret flights. They're literally flying illegal immigrants from other countries into the US without any processing or anything. And many of these immigrants, we don't know their health status. We don't know if they have tuberculosis, they have other communicable diseases. Nothing is done to monitor that at all. And of course, nothing is done to protect the Americans who pay all the taxes to pay for these flights. So one of the things I just want to show you is I personally have traveled in the airport recently, and I saw what appeared to be a large amount of illegal immigrants coming through a plane. Many of them had coughs. I could hear very deep coughs that I haven't heard in a very long time. And they reminded me very much of tuberculosis. And so sure enough, as we see here, we have record numbers of illegal immigrants coming to the country. Here's an article here from thehill.com showing that illegal immigrants doubled under Biden. That's just the very beginning of it. We also have new reports here from NBC Montana showing that Biden flew hundreds of thousands of immigrants into the US using a CBP1 app, whatever that is, basically getting people in. And finally, we have data from CNN, probably one of the untrustworthy websites nowadays. But even they are starting to admit that US tuberculosis cases are starting to skyrocket. A lot of physicians I know that are in the field are saying that it's way worse than the data they're reporting. And a lot of people believe the CDC is suppressing these numbers on purpose. But basically, tuberculosis is a very real threat to everyone. If you might remember in the past, tuberculosis used to be a very big deal. It was very common for people to die of tuberculosis and pulmonary infections. In fact, it was at one point one of the leading causes of death among all humans. So it's a pretty big deal. So today I wanted to take the time, mention that this is a major threat, and then talk about how you can know if you or a loved one or one of your neighbors might have tuberculosis and what you can do to treat that yourself and arm you with the medical knowledge you need to protect yourself and your family. The most common symptoms of tuberculosis are having a prolonged cough for usually greater than 2 to 3 weeks, usually associated with something called lymphadenopathy. It's a fancy medical word, but basically means that your lymph nodes are enlarged. So very often you'll see somebody who has had a prolonged cough for a long time. And when you go to feel their neck, you can feel their lymph nodes are very large. You can sometimes feel lymph nodes under the axilla, which is the armpit here. If you find lymph nodes, they're usually enlarged. It's also associated with a lot of fever. So people that have fevers and night sweats, those are other two common symptoms. And then finally, if you've had tuberculosis for a while, usually people will see weight loss with it. The other things that are important to remember is that if people are from an area that has tuberculosis, that's endemic, meaning a lot of people have it there, or if you've been exposed to someone who's had tuberculosis, like maybe you were on an airplane flight and you didn't realize that the other half of the airplane was illegal immigrants being flown in by your own government. Pretty important to know that. That would mean you've been exposed. The best way to diagnose if you have tuberculosis is to get a chest x-ray. Many times on the chest x-ray alone, you can see the tuberculosis. And the 100% golden way, the best way to confirm you have tuberculosis is to actually get a culture of your sputum, which is when someone coughs, the stuff that comes out when they cough. You can put that into a container, you can get it tested, and it can be tested for tuberculosis. And why that's important is that if you can get a culture, get a little bit of what the person is coughing up, you can also test that culture to see what antibiotics it is resistant to, because unfortunately, many of the tuberculosis now are resistant to antibiotics, meaning they're way more difficult to treat. So the gold standard for testing is chest x-ray first, followed by what's called a sputum culture, or when whatever people cough up, that's called sputum. If you can culture that and send it to a lab, they can test it, find the bacteria that are in there, the tuberculosis, and they can also test it to see if it's resistant to different drugs. And that information is very critical in order for you to treat, because if you know it's resistant to a certain medication, obviously you can use a different medication. And then finally, there are some new tests that are available called molecular tests. They may or may not be available in your area, but these tests can also test for the bacteria as well, the sputum that comes out. While the test is a little bit faster than the old test of doing a culture, waiting for the culture to grow, checking to see if the bacteria are there, and then figuring out if those bacteria are resistant. The new tests are a little faster. If they get the culture, they can test it right there and get the answer very quickly. And of course, if you have tuberculosis, you're supposed to report to your local health center. Hard to argue these days that the country has any interest in your public health if they're obviously flying people in that have tuberculosis and causing another pandemic of tuberculosis. But theoretically, if your public health area officials really cared, you should probably let them know, because they will try to quarantine you and basically usually will treat the tuberculosis for free with some antibiotics. If you want to go that route, it's entirely up to you. However, given what we've seen from the government so far, not sure I could trust that anymore. And here, what I wanted to do is I wanted to show you what a chest x-ray looks like of someone who has tuberculosis. It's very common for the tuberculosis to actually appear in the lung as a whited out field. Here on this x-ray, you can see that on the x-ray, you see the normal blackness of the lungs, which you would expect, because anything on x-ray is based on density, right? So if something's not dense like air, it's going to be black. If something's very dense like bone, it's going to be more white. So we see that there's air within the lungs, that's why it's black. And that in this person's right upper lobe, so when we say it's the patient's right side, the right upper lobe, it's basically whited out. It looks very white, and that is due to tuberculosis. So if you see this on an x-ray, this is something that's pretty important to know, and it would be indicative that this person has an infection in their lungs. So here's the x-ray of the same person, but now it's from the side. So we usually do what's called an AP, anterior posterior x-ray. We take a picture up front. We also take a picture from the side. We compare the two to get a better idea of what's going on. Here, when you look at this x-ray, just want to show you, once again, at the upper area of the x-ray towards the right side, you see it's whited out. And so that's where the infection is. You can see another white area towards the bottom, which you could also see in the previous x-ray, and that's actually the heart. So don't confuse the heart with an infection. It's a good thing. We need the heart. But you can see that the area that is infected actually is brighter in many cases than the heart, because that area essentially is full of fluid. It's closed down. Many times it's not exchanging air, and this is why the person is coughing and many times has issues. Let's also show you one more example of x-rays as well. This here is an x-ray of someone who has had tuberculosis for a while. In this case, it was a 40-year-old man who came from Dominican Republic to the US, had cough, fever, progressive hoarseness, and had lost over 40 pounds in weight. This is the first x-ray they got of him, and sure enough, what do you see? Basically, all sorts of the lungs are whited out. Looks like somebody took white out and put it all over the lungs. And you can see it's heavily whited out all over that lung. And this is a classic sign for people that have had tuberculosis for a long time. Here is the side view. Here's the other x-ray from the side for the same person. Notice here you see heavy whiteout in the lung. This is indicative that tuberculosis has spread all over the lung. Likely this person is not doing well. They're probably having severe night sweats, coughing all the time. And obviously in this case, this gentleman had already lost 40 pounds of weight, just because the body is eating up any energy reserve it has to fight this very aggressive infection. The normal treatment for tuberculosis involves the use of 4 very powerful medications. These medications are isoniazid, rifampin, pyrazimide, and ethambutol. These are usually administered for around 2 months. Realize that these medications can change depending on the resistance of the bacteria. So remember how we talked about getting that sputum culture? So you can get a culture of the bacteria, then basically you know that you can figure out what antibiotic treats what. So these antibiotics are very serious, they're very powerful, and you have to take them for a very long time in order to treat tuberculosis. So it's not an infection to take lightly. It's something that's very serious, and there are many people throughout history who have died of tuberculosis. Some of them quite famous. You probably have heard of Doc Holliday from the stories, like he was actually somebody who had tuberculosis as well. In summary, most important thing is that if you have been exposed to somebody who could have tuberculosis, you notice they're coughing, they're sweating, they're not looking good, maybe they're thin, they're pale, they may look like they've lost weight. Fancy word in medicine, we call it cachetic, like somebody who's lost weight or look clunking in almost. Run into anybody like that and you are having a cough for greater than 2 to 3 weeks, and you can have one or none of the following symptoms that are common. The other ones include fever, night sweats, weight loss, and hemoptysis, which is when you're coughing up blood. If you have any of those symptoms, obviously this is very indicative of an infection, but you can just have the cough and still have tuberculosis. Usually those other symptoms like fever, night sweats, weight loss, and coughing up blood are things that develop over time. If you do find any symptoms, or your neighbor has it, or your family member does, please realize there's a big potential they have tuberculosis nowadays, whereas 10 years ago, it would have been very rare. Now it's on the rise, so be very cautious of them and get that test. Make sure, see if they have the tuberculosis. If you can, get a sample of what they coughed up. That's the most valuable thing you can use. Send that to the lab. They can test it and let you know if they have tuberculosis and what antibiotics to use to treat it. So hopefully you found this helpful. I'm Dr. Adam Sewell signing off. Have a great day and have great health.